Welcome, everyone, to Talking Back to Suicide. This is your host, Dr. Diane Kaufman, though I also like to be called Dr. Diana for my creative self. I'm a poet, artist, humanism and medicine awardee, and internationally award-winning lyricist of suicide prevention songs, and I'm a retired adult and child psychiatrist. And the Talking Back to Suicide podcast is an outreach of the Hold On campaign, of which I'm the founder director. And we educate, connect, express, and heal using the power of art and art making. Our special guest today on Talking Back to Suicide is Samantha Foote. Samantha is a neurodivergent, board-certified music therapist, a registered Music Together teacher, and founder of Boise Music Therapy Company, Every Brain is Different podcast, and the Parenting with Confidence program. As the mother to 3 autistic children, Samantha is also a trained positive discipline parent educator, whereby she helps empower parents of neurodivergent children to feel confident, supported, and informed as they navigate the unique journey of raising their children. Through compassionate guidance and evidence-based strategies, Samantha aims to foster understanding, celebrate neurodiversity, and help parents and families and children together to thrive. She received a Bachelor of Science degree with Utah State University and completed a Master's of Music with a specialization in music therapy degree from Colorado State University. Samantha is a neurological music therapy fellow and has special training as a dialectical behavior therapy-informed music therapist. So very warm welcome, Samantha, to Talking Back to Suicide. Samantha, could you tell us what is music therapy?
Yes, so music therapy is using music to work on non-musical goals. Music therapists work in a variety of different settings with a variety of populations. So they work in hospitals, prisons, schools, private practice. I work in private practice, and I work with kids and adults who have autism, ADHD, other developmental delays, things like that. And so I mainly work on increasing speech skills, communication, motor skills, social, emotional, different things like that. And I use music to work on those skills. But it's not just going and doing like piano lessons or guitar lessons. Like we might do piano lessons, but we're working on motor skills. Or we might do voice lessons, but we're working on, like, for example, I had this kid who said, I have a really monotone voice and I want to increase my expression. So we did singing exercises. And just to be clear, it's totally fine if you have a monotone voice. He just wanted to increase his expression. So that's what music therapy is. Neurologic music therapy works on really using the brain. So if you want to look into that, it's really cool. They work a lot with stroke patients. And so patients who might not be able to walk very well after they have a stroke, and then they get neurologic music therapy and they can walk at a clear, consistent gait. And so that's
how does that work?
Things. Yeah, so it's just,
how does the music help the physicality?
Yeah, so music can access different parts of the brain. It accesses more of the brain than any other stimulus at one time. And so if a section of the brain is damaged, then it can access other parts of the brain to help you do that skill where that part of the brain was damaged. And then it makes new neural connections that allow you to do that skill without the music. So a really kind of famous example, it happened a long time ago, but Gabby Gifford was a congresswoman from Arizona, and she had a traumatic brain injury, and her communication center in her brain was interrupted. It was damaged. And so she credits music therapy in addition to all the other therapies that she had, like speech therapy, occupational therapy, physical therapy. But music was able to access a different part of her brain. So in conjunction with the other therapies, she was able to speak again, to walk again, because she had that music accessing those different parts where the other therapies, the traditional therapies, couldn't access that part of her brain to help her with those skills.
Do you think the general public is aware of music therapy?
No, they are definitely not. Well, especially where I live. I live in the West. I live in Idaho. And the farther east you go, the more music therapists there are. But the farther west you come, at least in the United States, the fewer music therapists there are. When I moved to Idaho in 2011, there was only about maybe 5 to 10 music therapists in the whole state. And now there's quite a bit more, but like I am only one of 2 companies in the area that I live in, or really the whole state, that even offers music therapy for children and adults with autism and, the developmental delays and stuff. And so it's definitely not well known.
How do you think it could become better known?
I think just advocacy. In a lot of states, there's licensure for music therapists, and so they're getting the government involved. And when there's licensure, then comes more funding opportunities. And in Idaho, at least, there's only one way I know of to get music therapy funded, and that's through a special waiver for disabilities. But in other states, like insurance might cover it. There's more funding sources because it's a better protected field. And so once funding sources become available, then the general public knows about it more because they're able to pay for it with those funding sources. I think just, grassroots efforts of educating people on what music therapy is. Like I come on podcasts like these to educate people on what music therapy is. And that's what we can do to better educate the public.
How did you become aware of music therapy?
Well, it was so random. I was a junior in high school and I was like, I need to know what I'm studying in college. And so I went on this college review website and I wanted to do something with music because I've been a musician my whole life. I'd been studying piano since I was 4 years old and I wanted to do something in psychology. And for music, I didn't want to be a teacher. I didn't want to be a performer. I wanted to use music functionally, but I didn't know how I could do that. And then I randomly found music therapy on this college review website. And looking back on it, it did not describe music therapy very well, but it got me in the field. So that's all that matters. And I took music therapy from there and just ran with it.
On your websites, you describe yourself as neurodivergent and say that up front.
Yeah.
Could you share a bit about your life journey and how you or your family, your parents came to know that, or, what was that journey?
Yes. When I was younger, I did not know I was neurodivergent. I just knew that I had big swinging emotions. I was very emotional. I was either super happy, super sad. There wasn't a lot in between, or I'd get really angry. And then I would talk all the time. I would just talk. Like the only time I got in trouble at school was for talking because my teachers were like, you need to stop talking. But I felt like I was going to explode if I didn't get what I wanted out. And then my mind was just going all the time. And then I had OCD tendencies where, I could only eat things in groups of 3. I couldn't eat things in groups of 4. There were dirty numbers. There were dirty letters in my brain. Like there were clean numbers and dirty numbers and all this stuff. And I just thought that was completely normal. I thought that's how everybody was. And then as I became an adult, and I also talked to my mom about it, and she's like, yeah, everyone's like that. That's just normal. You just have to deal with it. Because she has all the same things that I have and she just didn't know, so she did think that everyone was like that. Then I became an adult and I was in counseling and my counselor was like, well, I said, I think I have OCD. She's like, oh, you most definitely have OCD. And then I was on TikTok during the 2020 when the TikTok thing was going crazy, and a bunch of people kept talking about how they had ADHD and they had all the same things that I had going on that I just thought were my normal personality. And then I tried to get diagnosed, and my psychiatrist, because I had kind of a mental breakdown after I had my second child, I had really bad postpartum psychosis. And so I went to a psychiatrist and they diagnosed me with bipolar disorder. And I said, I really don't think I have bipolar disorder. I think something else is going on. And the psychiatrist said, yeah, you don't really fit bipolar disorder, but I just have to give you a diagnosis. So we're just going to give you this one, because you have to have a diagnosis to get counseling and medication and get the things you need. And I'm like, okay, whatever, because I just needed help. And then a few years later, I was actually getting treatment because my thyroid was kind of out of whack, but it wasn't working. And so the primary care provider said, this should be working unless you have ADHD. And I was like, yeah, about that. Like, I think I do have ADHD. And so she tested me, I did the assessment, and then I got ADHD medication, and that completely changed my life. I am so grateful for it, because the other medication that I was taking was, it was doing a pretty good job, like my anxiety was down, my intrusive thoughts were down. I was able to regulate my mood for the most part. But then I added the ADHD medication, and my anxiety kind of went away, and my moods were even more regulated. And so I'm just very grateful for that primary care provider. But that was the long story of my journey of how I got to those diagnoses.
And I ought to have asked you this up front, so I'll ask you now. How do you define neurodivergency? What is that?
Yeah, I would just say anything that if you think you have a diagnosis or you've been diagnosed with something, like obviously it started with the autism community and then it's grown from there. So I consider it to be like autism, ADHD, OCD, bipolar disorder, anything like that, dyslexia, all those different things.
And when you mentioned the medications, were you, when there was a bipolar disorder diagnosis, that, if I understand correctly, that was taken back at some point, that this was not a bipolar disorder. But were you on a mood stabilizer medication or an SSRI for depression/anxiety?
Yeah, I was on a mood stabilizer and an SSRI. Both, I'm on two different medications for that, and I'm still on them. It just, the ADHD medication in addition to it really helped just smooth everything out. It was like the missing piece. But yeah, that's what I'm on.
And the ADHD medicine, that's a psychostimulant type of medication?
Yeah.
And did you at any point have difficulty with side effects? Because that can sometimes happen. And could you talk about how you managed that?
Yeah. So when I first got medication, I went through a lot of different medications. It took a good year to find the right medications that I could be on in the right grouping, in the right dosage. So it definitely took time to find those medications. And then I had to go through all the side effects of the other medications that I was on. And I still have side effects. Like the main one is that, I don't know if you want me to talk about this, but like libido is down. It's just, that's been the main side effect. But other medications, the side effects were like, I was really itchy, or my brain just didn't feel right, or I had suicidal thoughts. There was one medication, like the second day I was on it, it was really bad. And so you definitely have to watch for those things, because side effects can be really hard. And sometimes, it takes a while for these medications to kick in a lot. And so you won't notice a side effect until like a month or two in, and you think you're doing really good on it. And then all of a sudden, all these side effects pop up. So there are side effects. Luckily, I didn't have it where you gain weight or you lose weight or, different things like that. And I didn't ever have any of those side effects. They were more like mental side effects. But yeah, those were the things that I went through.
And Samantha, did you feel comfortable, empowered to share with your provider what was going on with you? And did they listen to you?
Yeah, she was awesome. Like my first provider, all my providers have been really good, except one guy who said, he said, you have bipolar disorder. So if you cheat on your husband or you become a drug addict or you go on a shopping spree and ruin yourself financially, like don't be too hard on yourself. And I'm like, no, we're not doing that. And I am going to feel bad if I do that. Like if I cheat on my husband, yeah, that's going to be a problem. And so I definitely, and for counseling, I had to go through quite a few different counselors before I found the right one. So I just tell that to people all the time. Like, if you try counseling and your first one's not a fit, like, definitely keep trying. Like, I had to go through like 5 different counselors before I found the right counselor. But all the providers I've had, for the most part, have listened really well. Like I come to them and I say, you know, I don't think this is working, or I think this is working. Can we try this? And they're really willing to work with me, and I really appreciate that.
Good, good. Now, you mentioned that after the birth of your second child, you developed postpartum depression with psychosis. Could you talk a little bit about that?
Yes. So I had postpartum depression and anxiety after my first child, and that was really bad. You know, I'd just cry all the time. I'd have like really bad intrusive thoughts, like all that stuff. And then I got help for that. And then we kind of did the same protocol after I had my second kid, but it just wasn't enough. I think having a toddler and a baby and everything, all the hormones and stuff just kind of pushed me over the edge. But yeah, so I was struggling and I was like, no, I can get through this. Like, it's going to be okay. And I was talking to my doctor about it. And so he gave me medication that worked in the past. But then one day, I don't know what happened. I think everything just kind of piled on. And I just had overwhelming intrusive thoughts. And it was like, you need to end your life, like just overwhelming all the time. And then luckily both my sons were asleep. They were taking a nap when this happened. But I called like everyone I knew, and no one, I'm not blaming anyone, no one answered their phone. And so I did get a hold of my mom. She was about 6 hours away though. And I called her. I can't even imagine getting this phone call as a mom. Like I called her and I was screaming at her. I was like, I'm not okay. I'm not okay. And she was like, I'm on my way, but I can't be there, you know, right now. And so then I called like the suicide prevention hotline. I called the crisis hotline, and I was just in a state where they weren't saying what I needed them to say, I guess. I don't know. Like, I'm not blaming them. I'm just saying I hung up on them because I was like, this is not helpful. And then I passed out. I just fully passed out. And I woke up and my mother-in-law was at my house because my mom kept calling her until she answered, because she lived about like 15 minutes away from me. And so she came over, she helped me. And then that was a weekend, and my husband came home from work, and so he helped me. And then we went and on Monday, I called my provider and I said, I need help. Like, this happened over the weekend. And he said, why didn't you call 911? Like, this is a situation where you could have called 911 and they would have helped you. But honestly, I thought that they would take my kids away, because I knew if I called 911, that I would be placed in a psychiatric facility. I was nursing my kid, like my baby. I was like, well, how is he going to eat? He doesn't take a bottle. So, you know, and my doctor was like, yeah, they're not going to take your kids away because you're having a mental health crisis. But I was so worried that they were going to find me an unfit mother that I just couldn't do it, you know? And so anyway, that's what happened. And then I got help after that. Like, we started counseling, we started medication, all of that stuff after that happened.
Was the help that you received, was that outpatient help?
Yes. Yeah. I was never hospitalized. I've never been in inpatient help, you know, inpatient psychiatric help.
It's understandable, the worry that you had in that crisis. On the one hand, it's fantastic and a blessing that you had the awareness that something was wrong, right?
Yeah.
And you, I'm assuming, but tell me if I'm right, that you did not act on those thoughts, or did you come close to acting on the thoughts?
I did have some thoughts that I should not should, but like intrusive thoughts of harming my kids. And so I was like, I will end my life before I harm my kids. And so that I never did anything, like I never had a plan. I never had anything like that. I was just like, I will find a way before I harm my kids. But I never had a plan. I never knew like what I would actually do if it came to that. We do have protocols in place in my house just in case. Like my husband I own a gun. My husband owns guns, but they are in a safe. I have no idea where the ammunition is. Like he keeps that somewhere else. And so we do have like things like that in place, like in case something ever happens. Like I've never come close to that happening, but just safety precautions, I guess. Yeah. So that's what we do.
Yeah, I'm not myself familiar with this, but I'm wondering in medical care for a pregnant woman, right? And pregnancy as well as immediately postpartum, is there education? Do you know? Is there education about postpartum depression and mental health distress and disorders, especially after the delivery? And I think it's even upwards to a year or more that a woman is at increased risk of suicide postpartum. And this is a serious problem, of course, and it can be prevented. Do you think that there's guidance given by obstetricians and gynecologists or enough information given about it?
There is not enough information. I had to really seek out help, especially with my first kid. No one said anything. Like I knew about postpartum depression because I'm in the field. I'm in the mental health field. And that's like a special interest of mine is mental health, like help, right? And actually, I went to my first provider after my first son, and I was sobbing. And he was a family practitioner. So he was my son's pediatrician and my provider. And we were doing my son's appointment and then my appointment. And while my son was getting checked out, I was just crying and crying. And I was like, I think I have postpartum depression. Like I can't stop crying. I'm having intrusive thoughts. I'm having all this stuff. And he said, it is your son's appointment right now. We will talk about you later.
Oh my goodness.
And I was like, okay. So in my head, my son is more important than I am, which obviously he's important, but I was just trying to be a good mom and I knew that I wasn't okay. And so, nobody told me. They talk about baby blues. They're like, after you have a baby, you're full of hormones. You might feel a little sad. No one told me about postpartum anxiety or psychosis or the signs to look for. Like nobody said anything like that. And I will say my husband also had postpartum depression. Like, I don't know what it's called in men, but he had depression after I had my son. And so there we both were. I remember we were watching the Harry Potter series and they're really dark, like they're really depressing, the last few movies. And we had to shut it off because we were just in such a bad state. We're like, we can't watch this anymore. So nobody talks about like, oh, if you have these signs, get help before it's too late. And I really think like we take classes on parenting, we take classes, like we go to the hospital and do a hospital tour. Like I did the birthing class, like I did all of that. Never was there mentioned anything about postpartum depression.
And it could be so easily incorporated.
Yeah. Like in the birthing class, in the parenting class, like in any of those classes that they offer you, or even like I went to like a Baby and Me, just kind of like support group after. And it was just a place where moms could go hang out with their babies and hang out with each other new moms. And even in that, they could mention there like, hey, if you're experiencing these symptoms, get help. And nothing was ever mentioned in there either.
But Samantha, I was reading an article recently, I would say within the last 2 weeks, and it talked about something that you mentioned earlier. It talked about that there should be follow-up by the primary care doctor or the pediatrician, right? That's with those, the first week after the baby is born and the second week, the routine follow-up, that it should be joint with the mother.
Yeah.
right?
Yeah.
That they're a unit. So
Mm-hmm.
talk about the baby, also talk about
Yeah.
the mother, talk about what's happening with the relationship between the two.
Yeah.
And not, as you were saying, like, this is the baby's time. We'll get to you later. The later could be okay if it's in the same appointment. But it was
Yeah.
interesting that they were talking about that there's too much of, for lack of a better word, like separation or siloing, like this is the baby's time. And
Yeah.
no, we're not going to talk about you as the parent time.
Yeah. And I think, like, I haven't had a baby in 6 years, but I think with my youngest, they did have a questionnaire that I filled out when I took her to her doctor's appointments after she was born that did ask about my mental health. So that was good. They're going in the right direction. And her doctor did ask, like, how are you doing? How is everything going? But with her, I was great because I had a psychiatrist, and we had a plan for after I had her. And so I didn't have anything with her because I had all the support. But I didn't get anything like that with my first or second son.
And I'm thinking too that, I'll put it in quotation marks, that the mother could feel, quote, ashamed and not want to share, like, I'm feeling disconnected from my baby, right?
Yeah.
Or I'm having thoughts to hurt my baby. I'm having thoughts to hurt myself. I'm feeling like I'm, in quotation marks, a bad mother, that I don't want to tell anybody what actually is going on. And yet that person is not a bad parent, a bad mother, that there is a mental health / medical problem that's going on. So I think you're right. There just needs to be so much more conversation to shine a light on this, because you could have the questionnaire, which is wonderful. Yeah, like, yay for the questionnaire. Then it becomes, does the woman feel comfortable sharing what's actually going on?
Yes. Yeah. I think shame is probably the number one emotion that people with mental health issues face. And because it's not something that you can see, like, it's not like I broke my arm. Your brain chemistry is off, and that's not something you can see. And there's so much misinformation. Like, I was just at a family event, and one of my cousins was like, taking pills for mental health is just like taking drugs off the street. It's the same thing. And I'm like, whoa, no, it is not. Like, but that's what people think. And so I am very comfortable in taking medication, talking about taking medication, even when I was down around my whole family, and there were people that were saying stuff like that. I kind of shrunk back and was like, oh, I don't want to talk about how I take medication, because then they'll think less of me because I can't just deal with it. But you would never tell, like, someone with diabetes, don't take your medication, but it's the same exact thing. So in your brain chemistry is off. You need medication to make it right, And so, yeah, I kind of felt ashamed, and I'm usually very comfortable in just talking about using medication, using counseling, using all the mental health things that I use. And if you were new or you were questioning whether or not medication was right for you, because medication's not right for everyone, but a lot of people, I think, don't take it because they're like, well, that's a crutch. And I just say, no, like, your brain chemistry is literally off. Like, it's a physical issue, So
I'm thinking too, and I wanted to ask you about your thyroid, that if you're having too much thyroid hormone or too little, it can dramatically affect your mental and physical, well-being. In fact, in terms of a mental health difficulty, a thyroid difficulty needs to be ruled out, right? But you wouldn't say to someone, just buck up, you don't need your hormone replacement, right? You're a weak person, right? Or this is a character flaw if your thyroid is off. And our brain is part of our body, right?
Yeah.
So talk a little bit about, if you could, about the thyroid symptoms that you were having.
Yeah. My weight was really wonky. And it was after I had a miscarriage, and I did not know this, that after you have a miscarriage, you can have thyroid issues. And so I was just like, I had a lot. It's just my ADHD symptoms seem to be amplified. So with my thyroid stuff, and I was just like on a roller coaster of emotions. My heat regulation, like heat cold tolerance was off, and I couldn't lose weight. And then my iron was also low. So it's hard for me to know what exactly was thyroid and what exactly was the iron, because my iron was super low too. And so I was getting like all the oxygen goes into your core. You know this, like the oxygen goes into your core organs. And so like my feet were going numb, my legs were going numb up to my knees. I thought I had blood clots because my legs were going numb and all of that. And it just turned out to be my thyroid and my iron levels were off. And that is so common after miscarriage. And nobody told me that. And so like my mental health, like I was like depressed or whatever because I had the miscarriage. But I went to my first primary care provider and I said, I don't think I'm okay because I'm having all these issues. And he was like, well, you went through a really traumatic event. You just have anxiety. He didn't do any blood work, nothing like that. So then I changed primary care providers because I was like, I need help. And he's just saying, oh, you have anxiety. I think I could have been like bleeding out and this man would have said, you have anxiety. So then I went and I got blood work done, and that showed the thyroid and that showed the iron and some other issues going on. But yeah, so anyway, there's that.
I am so glad that you advocate for yourself, right? That you knew something was not okay, right? And yes, you shared the information, but then you further advocated for yourself, like, I need a blood test. Let's not conclude this is because anxiety, what is a subjective word to feel anxious, but there are multiple causes for anxiety, right?
Yeah.
And you're right? A thyroid condition can cause anxiety, and other physical difficulties can cause it. And also sometimes, and because life is complicated, sometimes there can be more than one thing going on at the same time, right? Right. That you had a traumatic loss, which is impacting you, but that doesn't mean that other things might not be going on, right?
Yeah.
So good for you for standing up for yourself.
Yeah.
Now you mentioned in your introduction that I read from your website that your 3 children have autism. How did you learn that, and what was the process, and how young was it when you were thinking that developmentally something was a little different?
Yes, my oldest son was actually 2 months old when his pediatrician said it is way too early to diagnose him, but we're going to watch because I think he might have autism. He said that because my son wasn't smiling, he wasn't making eye contact, he wasn't doing the interactions that a typical 2-month-old does. And so, we just watched it. And then when he was 2.5 years old, we took him in and got him assessed because he didn't like being around people, and he liked being around people that he knew. But like we would go to the little gym and do like a mommy and me class, and he would be where the people weren't. So if everyone was on the big red mat, he would be in the gym. If everyone was in the gym, he would be on the big red mat. And then we would go to families like my grandma's house, and I have a huge family. There's like 80 people in my grandma's family. And he would hide behind the couch so that none of the kids could, like, he would play with the kids for a little bit, and then he would hide behind the couch because he was done peopling. He was done with people. And then he wasn't talking.
I was going to ask about his language development.
Yeah, he could say a couple words, but he didn't really talk till he was like 3-ish. And then he had aversions with sensory input. So if he got dirty at all, he would just sit there and cry. On his first birthday, we had the smash cake, and he got his hand in the frosting and just completely lost it. Like, started crying and throwing a fit. And then he kicked out his leg, and his leg got in the frosting. So that was even worse. So I had to go give him a bath in the middle of his birthday party because he couldn't handle anything being on his skin. And so those were kind of the things that we saw and why we got him assessed. And he got diagnosed with autism when he was 2.5. And then his brother, I was actually surprised when his brother got diagnosed with autism, but the older he gets, the more I'm like, oh yeah, there it is, because I thought he just had ADHD, but we got him the full psych eval, and they said he has autism and ADHD, and he didn't talk till he was 3 again. And now when he would go to the park, if a kid approached him, this was after we got him assessed, but he was a little bit older, and we would go to the park, and if anyone approached him, he would just fall on the ground to pretend that he died so that he didn't have to interact with the kid. And so there's stuff like that. He has sensory issues too. He's a really sensory seeker. And so he's always trying to get that input into his body. And then he has a really hard time with friends, like understanding sarcasm, understanding when, like, you're invited to play versus when a group might not want you to play with them, or stuff like that. And then I don't even know why. I didn't suspect it in my daughter at all, because I wasn't seeing the stereotypical signs that are in boys. And she got occupational therapy because she kept falling down. And so her neurologist said she needs occupational therapy to teach her body how to move appropriately in space. And her occupational therapist was like, I think she has autism. You might want to get her assessed. So we got her assessed, and she has autism and ADHD too. And so it's not really surprising. Like, in my husband's family, there is a kid, he has 3 sisters, and there is a kid, at least one kid in every family that's diagnosed with something, like neurodivergent wise. And so I'm not really surprised that all my kids are diagnosed. And then after they got diagnosed, my husband got diagnosed with ADHD and OCD, and I got diagnosed with ADHD. And so, neurodivergence, it's not surprising, but that's how we kind of got everyone diagnosed.
What was it like for you and your husband to receive the diagnoses?
I think it was easier for me because I'm in the field. Like, I work with kids with autism all the time. And so I was just like, well, this is what we're going to do. Like, and it's funny because when I first started out as a professional, someone was like, you're going to have kids with autism because you work so well with kids with autism. And I'm like, yeah, that's not how that works. But when you marry someone whose family has lots of autism, that is how that works. But yeah, so I think it was harder for my husband because he just wasn't expecting it. And in general, I think it is harder for dads to receive the news. Like, I know a lot of dads who they didn't want their kids to be diagnosed. They didn't want their kids to be assessed. Once their kids did get diagnosed, they were like, no, that's not true. My kid is normal. He's fine, And I'm like, well, there's nothing wrong with your kid. They just have a different way of thinking. But I have seen a lot of dads like don't want their kids to get like therapies because they don't want their kid to be different. And it's just harder for them to accept it. My husband was like, okay, I guess this is what we're doing, because he knew, a lot more than the average dad, I would say, because he's married to me and I tell him about my work. But yeah, he definitely had a harder time accepting it.
How do the 3 children get along with each other? What are their social interactions like as siblings?
Yeah, I don't know what typical sibling interactions are like because I was an only child until I was like 13. So I don't even know what it's like really to have siblings that are anywhere near your age. And then but they play together. They do get frustrated with each other because like my one son is a sensory avoider, my other son is a sensory seeker. And so the younger one is super loud, wants everything to be loud, wants to play music all the time. And then the sensory avoider is like, shut the music off. Like he actually took our Alexa device and hid it so his brother can't play music on it anymore. And so there's stuff like that that's harder. But they interact pretty well together. They play together. It's just one person's triggers is another person's thing that they like. And so that's what's really hard. Like especially when we're in the car and my younger son will be humming or singing or just making noise in general because that's how he regulates his body. And then my sensory avoider son is like, stop making noise. I need it quiet. And so we make sure that we have, the noise canceling headphones. We tell my younger son, like, hey, you can do what you're doing, but just maybe bring down the level of the sound a little bit so that you're not completely overwhelming the space with sound. And so we try different things like that. But yeah, it can get difficult sometimes, but for the most part, I think it goes pretty well.
A little bit about your daughter's presentation with autism, because the way that it presents is different than with boys.
Yeah, she just goes quiet a lot. So she is an observer. When she is around people that she knows, she's, talking and laughing and like all that kind of stuff. And then when she gets in an unfamiliar system, I honestly thought that she had mutism because she will not talk and she won't approach people. It's really hard for her to make friends because she won't join in on a group. And then she had her, there's some sensory issues going on where she isn't as like sensory avoidant or seeking as my boys, but she had occupational therapy, for regulation. It's more the regulation, like her nervous system gets overwhelmed and then she just explodes. And so we're really trying to teach her about regulation, like, if your clothes are bothering you, then let's change your clothes before you explode. Or she's very particular about the clothes that she wears, the textures that are on her body, just things like that.
Could you say something, Samantha, from your own experience with your children, as well as a mental health professional? What is occupational therapy? Sometimes people can hear the word occupation and they think it has to do with work.
Yeah. So it is about work, but the way it was explained to me is a kid's work is play. And so we're teaching them how to be in their environment and still do their job, quote unquote job. But occupational therapy, it is way more than I ever thought it was before my kids started getting it. So my kids, and I've worked with people, they work on motor skills. So gross motor skills, fine motor skills, so you have the gross motor skills that are jumping, walking, skipping, like just coordinating your body movements. And then fine motor skills like writing or coloring or, different manipulating objects, stuff like that. And then the occupational therapist worked on feeding. So my son has a really restricted diet. So she did feeding therapy with him, where she taught us how to introduce foods, how to help him interact with foods. And then they work a lot on body regulation. And so emotional regulation, understanding the signs that are coming into your body, like what do you do with the input that's coming into your body? How do you regulate your body so you don't have a meltdown or you don't have, a blow up or whatever? And then when my oldest son was in occupational therapy the first time, he worked on, it was kind of like exposure therapy, but with textures. So I'm not saying that you need to change your kid if they don't like a certain texture, but it was really interfering with his life where he couldn't get dirty, he couldn't touch anything, and he had to immediately wash his hands. And so we worked on, like touching shaving cream, playing in shaving cream, just different things where he could handle different textures touching him. So those are the things that the occupational therapist worked on with my kids. And I've co-treated with occupational therapists where mostly what they were working on was like motor skills. So I would co-treat with them because the music activated the brain in a way that the kid's brain couldn't be activated on its own. So they wanted them to do different movements, and I would sing the movements that they were supposed to do, and that helped them be able to do the movements better than if they were just like, okay, do a bear crawl. And the kid couldn't do a bear crawl because they couldn't organize their brain in a way to help their body move. But when I did the music, it helped activate the brain to be able to do the movement.
When you say, Samantha, co-treat, were these with clients, patients, or also with your own children when they had occupational therapy?
It was just, I just did it with my clients and patients, yeah.
And has music therapy been used to help support your children too in their emotional regulation? Could you say something about that?
We, the biggest thing, I don't do it a lot, but like I do have a music therapist that comes and works with my oldest son because I don't want to have that therapeutic relationship with him, you know? But with my other kids, I don't have a therapeutic relationship with my other kids, but we'll have like dance parties. If I see that they're getting kind of overwhelmed, I do know why, but dance helps them just relax and bring fun back in and just kind of chill everything out. Or my daughter is working on fine motor skills, and so she is taking piano lessons. We make up songs about how to regulate your body. I sing to them. I sing instructions to my kids. So in the morning when they have to wake up, I'll just get up and I'll say, wake up, wake up, wake up, wake up, instead of just like constantly being like, get out of bed, get out of bed, get out of bed. And so, or I'll turn on like soft music and slowly wake them up instead of just like dragging them out of bed. So just different things like that. We do small things.
Now, you mentioned meltdown, right? Blowout.
Yeah.
Okay.
Yeah.
Could you describe what that can be? And I want to share from being a child psychiatrist, I had many parents sharing about meltdowns, and at times I've witnessed them in the office, and they can be quite something, and the child needs help, right? And I would say the parent needs help too, because to see your child in such distress, okay, can be overwhelming for the parent too, right? Let alone that some of the parents themselves may also be neurodivergent or have autism themselves. So say something about that.
Yeah, so meltdowns happen when a kid's nervous system is just overwhelmed. It's not that they can't control it. And so many parents think that, oh, my kid is just having bad behavior.
Yes, I was going to say that they're being bad.
Yeah, they're being bad, but really it's just kind of a cry for help. And so meltdowns can be yelling, screaming, kicking, throwing things. It can be anything. I know someone who their daughter would get overwhelmed and she would just throw things off the walls. And so we worked on emotional regulation with her so that she wasn't doing that. But from an outsider perspective, people would be like, oh, you just have to discipline her. And by discipline, they meant punish her into not doing that behavior anymore.
If they're behaving bad, which they're not, but if somebody else thinks they're behaving bad, then you must be a bad parent.
Yeah. And so many parents are like, why? Or this is the biggest one I see where parents feel bad about their parenting. They say, my kid behaves perfectly at school. And then they come home and they have meltdowns. And I said, yes, because they're masking at school all day. And masking is just pretending to be like, quote unquote, normal, like typical. And they are hiding their true selves. And then they get home and they finally relax, but they've been, their nervous system is on high alert because they've been masking all day. And so then they have a meltdown because one little thing happens and they feel safe in your home to have a meltdown they don't feel safe to be themselves at school. And so they come home and they have meltdowns because they finally feel like they're in a safe place. And so I was like, if your kid's having a meltdown in front of you, it often means that you're doing a good job at like helping them feel safe. But what we want to do is help them feel safe at school too, so that they don't feel like they have to mask all day. So then they come home and have a meltdown. Like, obviously, we don't want them having meltdowns at school, but we want their nervous system to be regulated the whole day so they don't come home and start yelling and screaming and throwing things and, you know, just having all that different meltdown behavior.
And I was thinking too,
Yeah.
perhaps also at school, that rather than quote masking, they're emotionally regulating at school. So building up those skills. Now, what about you as a loving parent, but yet at times being bombarded by your children who are through no fault of their own, out of control? How do you help yourself to emotionally regulate?
That is such an important question. And I try to do self-care. So I try to do things that will minimize my nervous system escalation. So like I play the piano, I listen to podcasts, I color. Actually, I do laundry, like if I just put on a podcast and listen to it and do laundry or clean or something like that, that really regulates my system. But also like going out with friends, or last night I went to a concert, just doing things that fill my cup so that when my kids bombard me with their things, I'm not completely empty. And so I don't react, like I don't have a meltdown myself because my nervous system is escalated. And so I think just doing those things and having someone watch my kids so I can step away for a little bit. And I know that is so hard for the parents who are raising kids with disabilities, because it is so hard to get a babysitter that you trust to watch your kids. Because if your kid has like, if they elope, if they run away, if they, you know, if they have these like maladaptive behaviors where a typical babysitter wouldn't be able to handle them, or they have like complex medical needs, it's really hard to find someone to watch your kids. And so I get that. But even if you can just step outside for 5 minutes and just breathe and be by yourself for 5 minutes, I think it's really important for parents to try and get that any way they can.
Are there, through different organizations or agencies or providers, like respite care?
Yeah.
And could you say something about that?
So there is respite care. In Idaho, you can get on the Katie Beckett Medicaid waiver and get on the developmental disability waiver if you have a developmental disability, and they have respite care through providers through that. The problem is that it's really hard to find a respite provider because they pay so little. They pay like $8 an hour, I think. And so it's really hard to get respite because there's not a lot of providers that are willing to do it. There's another program that you can get a community support worker where they take your kid out into the community and they pay about double what respite pays. And so that's good, but it's still not a lot. And so that's the problem. There are resources available and services available for families that the state pays for, but the state won't reimburse at a rate that's sustainable for businesses or for independent providers to provide that service. So it's really hard to find providers.
For policy change.
Yes.
So tell us a little bit about is it the Confident Parent Program? And did you develop that? And what's that all about?
Yeah, so I noticed that in my work, people would get an autism diagnosis for their kid and they had no idea what to do. They didn't know what it meant to be autistic. They didn't know what it meant to be neurodivergent. They were using traditional parenting strategies that just weren't working for them and their kid because their kid's not traditional. And so I developed this program. It's a community now. So you can enter the community, and there's like educational videos about what it's like to be neurodivergent. So we talk about like sensory needs, the nervous system, what a meltdown is, what to do in a meltdown. And then we talk about positive parenting strategies. So instead of punishing your child, what can you do instead that research has proven actually works better than punishment? And then
Could you give a couple of examples?
Yeah, like my favorite one from positive discipline is connection before correction. And that means if your child does something that needs correcting, you don't just automatically go to a punishment. So for example, my son was super excited one day. He swung a squishmallow. It hit a pot, a planter pot that I had, and the pot fell on the ground and it broke. Obviously, that needs correcting. Obviously, we need to talk about how to control your body so you don't break things. But instead of just saying, go to your room right now, you need to think about what you did. You know, I got on his level and I said, are you okay? What's going on?
And say what you mean by got on his level.
Oh, I got down. I made like, I don't force eye contact, but if he wants to make eye contact with me, I am at his level where he can make eye contact with me. And so that's one of the things everyone's always like, make eye contact, make eye contact. Don't make your neurodivergent kid make eye contact with you. I guarantee they're not listening to you if they're looking into your eyes, because they're noticing your facial expressions. They're, at least when I make eye contact, I'm like, am I making eye contact too long? Is it weird now? Like, what's going on? And I'm not listening to the person talking. So anyway, you get on their level where they can make eye contact with you if they want to, and you're not like towering above them, because that's intimidating to a kid, you know, when you're just above them and you're slightly annoyed or mad.
It's funny,
or whatever.
it's literally looking down on someone.
Yeah. And so if you just get down where they can, you know, like where you're on their level, then what I did in that moment was I said, okay, the pot's on the ground. What do we need to do to make it right? And he was like, well, we need to clean it up. And I said, okay, how are we going to clean it up? And I problem solved with him to solve the problem, instead of just getting mad and saying, go to your room, think about what you did, or go to the corner, or, you know, like spanked him or whatever. Like, that's not teaching him anything. That's not teaching him how to solve the problem. And then I said, okay, so we need a pot for the flower now because we have to replant it. And so he's like, oh, well, I said, how are we going to pay for it? And he was like, well, I could give you money, or I could do extra chores, or, you know, like, and not everyone has to do that, but he was old enough to where he could replace the pot, you know? And then, so we cleaned everything up. And that's what I'm talking about, like connecting with him. Like, I got down, I talked to him, I wasn't above him, and we problem solved how to solve the problem that he made, rather than just me cleaning it up by myself, making him feel bad for doing it, because he didn't do it on purpose. And even if your kid does do it on purpose, I would still do these things because they did something that they need to solve now. And yeah, so we did that. And if you just yell at your kid and punish them, it's not teaching them how to solve it. And then we actually did talk later. We came back and we talked about it. And I was like, okay, what was going on that you swung the squishmallow and hit the pot? Like, he's like, I don't, because he wasn't mad or anything. He was just overexcited. And he was just like way too excited and just being silly and stuff, you know? So I said, okay, what can we do next time when you're feeling like this? And this is obviously a lot of words. And so if your kid can't handle that many words, like my kid could. And so we did talk about it. But if your kid can't handle that, you can see, like, you have to really be a detective and have to see what they're doing. And it might take a few times where they do something that you understand, okay, what was happening before this happened? What is happening after it happened? And what is the behavior that's happening? And how can we help this behavior not happen anymore? So anyway, there's a bunch of different examples for that. But other times, like if he wasn't as verbal as he was, if he couldn't process things like he could, I would probably say, okay, we still need to clean it up. Like, you're going to help me clean it up. But then to solve it so that didn't happen again, I would have to watch him more and notice his escalations, notice when he's getting too excited or mad or whatever, and intervene before it escalated to the point of something breaking, you know?
Sounds like, Samantha, that connecting part includes understanding, right? Understanding and non-judgmental curiosity.
Yes,
What
yes.
happened? Why? How can we make it better?
Yeah, that is the biggest part. I tell parents, like, you have to be curious. I can't remember his name. His name is Matt. His Dr. Matt. He was on my podcast and I love what he said. He said, get curious, not furious. And
That's
so
great.
when your kids make a
Curious, not
mistake,
furious.
yeah, just get curious. Like, what's going on? What happened? Instead of just getting mad and yelling at them.
What would you say about how can we as adults, and this is broader, larger than the neurodivergent population, but all of us, right? How
Yeah.
can we connect with ourselves, right? Because I was thinking as you were speaking, Samantha, that a person could potentially not even be aware that they're having a problem for which there is help, right?
Yeah.
A person could just think, well, this is just me and this is just how life is, right? How do we connect with some sort of a knowing like, oh, I'm becoming emotionally dysregulated and I can do something about that in a positive way rather than to become just immersed in the feeling and in the thought and just be stuck there and it's just spiraling down. How do we connect on another level with what's going on with us?
Yeah, I would say counseling for me has been the biggest thing on how to connect with myself and really understand what's going on. And so if, you have the resources, if you notice that you're doing things that you don't like or that, don't feel comfortable, I would definitely seek out counseling just to explore that. Like, you don't have to have a mental health disorder, to get counseling. If you're just losing your temper more than you would like, or you're, getting sad all the time because you do something, that just stuff that's going on that, like you said, like emotional regulation stuff, you can definitely work with a counselor. I would just get curious, not furious with yourself. So I noticed that I get angry every day at 5 o'clock, every day, if I don't get the right amount of alone time for myself. And then I actually talked to my provider because it wasn't every single day. It was every day, but there were certain days of the month where it would be way worse. And so she's like, oh, you need this hormone. And so I started taking that hormone and it kind of went away. Like, my anger dissipated. And so just talking to your doctor, if you have a psychiatrist, your primary care provider, a counselor, even talking to a friend, and just I'm a verbal processor. And so I solve things as I'm talking. So if you have a trusted friend that you can talk to and just say, I just need you to listen. I don't need you to solve anything. I just need you to listen to me. And then you can go to them and you can be like, okay, every day at 5 o'clock, I am getting angry and this helps me. This doesn't help me. How can I get through it so that I'm not so angry every day? And they can obviously talk back to you and stuff, but sometimes I just need to talk it out or just talk to a trusted friend. So those are just some ideas that you could do.
I was thinking too, as you were just speaking, and this wasn't the situation for you, but sometimes if a person might be taking psychostimulant medication for their ADHD, as the medicine wears off later in the day, if they're taking a longer acting medicine or even the shorter acting, which is upwards to 3+ hours, as the medicine wears off, that their mood can become more sensitive too. But it goes back to what you're saying, that you were in a healthy sense observing yourself, right? Being aware of yourself and then being curious about what is happening, right? And who can I speak to about it? And I'm thinking too that a person might want to write down something and give it to their provider as well, right?
Yeah.
Sometimes we go and see the doctor and maybe our mind goes blank, right?
Yeah,
right?
I do that all the time. Before I go to the doctor, I write down what I want to talk about and what my symptoms are, because they'll be like, hey, what's going on? I'll be like, I don't know. I'm fine. because I'm feeling fine in the moment and I don't remember all the stuff that was happening the day before or the weeks before or whatever. So sometimes I'll send my doctor a message and be like, this is what I want to talk about in our next appointment. And so they have it. They know in advance what you want to talk about. And so that's just something that you can do too, but definitely write it down, because you won't mention everything that's going on, I guarantee you, in an appointment. So,
yes. When I was practicing child psychiatry, I had put together, maybe it was about 2 pages long, but it was a series of questions. And it was sort of like the parent writing how their child is doing in comparison with the last time, within the last month, how they're doing now, and their behavior, their successes, home, school, family, etc., or any side effects, because it occurred to me that in this session, there's just so much time, okay? And you can spend the time talking about the past, and you need to be talking also about the present. So why not be able to share information prior to the appointment?
Yeah, because then it helps providers, like you said, providers and the patients. Like,
if you want to maximize the benefit.
Yeah.
So on the theme of talking back to suicide, and I know it was years ago when you had related to the depression, postpartum depression, and the psychosis. If there were someone in the audience right now who's feeling helpless and hopeless, and they're feeling so hurt and in so much pain that they might be thinking of ending their life, what would you say to them?
I would say start building your mental health network. So for mental health issues, we can have, peer support, personal support, professional support, any of those things, and just pick one person that you can talk to. Is there a friend that you can talk to? Do you need to call the crisis intervention line or the suicide hotline? Is that all you're comfortable? So you can stay anonymous, is that what you're comfortable doing? Can you find a psychiatrist? Is that someone, that you go seek professional support? So talk to your primary care provider and say, you don't have to tell them what's going on. You can just say, a referral to a psychiatrist, or I need a referral to a counselor, or just, I know when you're in that position, everything seems so daunting and you're ashamed that you're even feeling that way and you're depressed and all of that. But if you can just pick one person, whether it's your peer, a personal person, or a professional person, just pick one person to reach out to. That's easier than being like, okay, I need to build my whole network, and I need to get the professional people. I need to get friends to talk to. I need to get peers to talk to. And that's completely overwhelming. But just pick one person or one resource to go to.
Reach out and to share, I'm not feeling okay, right?
Or just go to the ER and just
yes, exactly. Go to the crisis center, go to the emergency room.
Yeah. Or there's a crisis center in Boise that you can just go. You're not going to be in inpatient help. You're not going to be automatically as an inpatient person. They're not going to do a hold or anything on you. You can just go to their crisis center and just be there and just sit there, and you can hang out with the people there. You can be by yourself. You can watch TV. You can play games. You can do whatever you need to do, but you can just be in a safe place. And then if you need further help, they have those resources for you.
Thank you so much, Samantha, for being with us today. Could you share your website addresses too?
Yeah. So if you go to everybrainisdifferent.com, you can find more information. And then I obviously have BoiseMusicTherapyCompany.com, but that is long and cumbersome, and I don't know why I made the website that. But everybrainisdifferent.com is a little easier. So
thank you so much, Samantha.
Yeah,
it was
you're welcome.
Really wonderful speaking with you.
Yeah, thank you.
Okay, bye-bye.